From the Gert Boyle studio, it's OPB Politics Now for Thursday, September 18th. It's been 5 years now since the first case of COVID-19 was reported in Oregon, and a global pandemic shook our lives and politics. The virus is now endemic, a permanent feature of life, causing less destruction and loss than it did, but still sending people to the hospital and worse. This is the time of year when boosters for COVID and the flu are typically available, but those boosters have been caught up in fights at the Centers for Disease Control and Prevention and allegations the agency's scientists are being sidelined by politicians. This controversy has prompted West Coast states like Oregon to create their own COVID-19 vaccine guidelines, and all of that has rekindled a simmering political debate around the effectiveness of these vaccines. What could this mean for Oregon's role in healthcare? Let's dig in. Welcome to the podcast. I'm OPB Politics reporter Bryce Dole.
I'm OPB health reporter Amelia Templeton.
Amelia, it's great to see you. Thank you for being here.
Absolutely.
Let's start with the latest news. Oregon Governor Tina Kotek is pushing for this widespread access to COVID-19 vaccines in Oregon. Yesterday, she joined governors from California, Hawaii, and Washington issuing new guidance. Why is this happening?
Well, I want to take a step back. In essence, it's happening because of a number of steps by the federal government to make access to COVID-19 boosters this fall more limited. Mm-hmm. This really starts in the spring. At the same time, these boosters, that have been designed to better match the variants that are currently circulating were being developed. The leadership at the Department of Health and Human Services published a commentary in a scientific journal that explained that they wanted a different approach to COVID-19 vaccines. They essentially said it's time to end universal access to these shots and to shift to targeting them at groups that are at higher risk due to the virus. So people 65 and over, because there is a strong correlation between your age and the risk posed by COVID-19 for many people. Mm-hmm. People with underlying conditions. And they said that many European countries have already shifted to this kind of a risk-based approach.
Mm-hmm. And that seems like a pretty reasonable, right?
Yeah. I mean, I think this core question of, as this virus becomes endemic, who needs boosters, how often, that is a good question to ask. Mm-hmm. I think it's a question the public shares. Data for our state shows that, last year about 20% of Oregonians got the updated COVID-19 booster. Now, that number was a lot higher for older adults. We could all benefit from more thorough public discussion of what the evidence shows about the efficacy of repeat booster doses. But that is not really what happened. Mm-hmm. Like a more thorough, informed public conversation or exploration of the science. The state's health officer told me that where things started to shift for him was, a series of events and decisions at HHS and at the CDC that led a lot of people in public health to worry that the decisions being made about the COVID-19 vaccine and perhaps other shots weren't being driven by, a careful review of the evidence, but had been predetermined. Mm-hmm. So to run through some of the events, Robert F. Kennedy Jr., who is the head of HHS, fires members of a very important committee, goes by the acronym ACIP. That's the Advisory Committee for Immunization Practices. He also bars liaisons from all the major medical organizations who had long kind of been, secondary advisors to this group, bars them from participating in work groups entirely. The group postpones voting on COVID-19 boosters, and they do vote to ban flu shots with a preservative called thimerosal, an ingredient that the CDC says there's no evidence is harmful at the doses found in vaccines. And then I think, what the public will be most familiar with is that the director of the CDC, who is a respected scientist and appointed by President Trump, was fired. By her account, what she's told senators just this week is that RFK Jr. tried to force her to agree to changes to vaccine guidance before she had seen them or seen any underlying data supporting them. So, all these events after this last month, shortly after that firing, Oregon, Washington, California, and Hawaii said that they had lost trust in the CDC and would go it their own way.
Mm-hmm. So what are the recommendations that they are putting forward now?
So they've put out recommendations for COVID-19, RSV, and influenza, the sort of big three respiratory viruses. RSV and influenza typically peak in the winter. COVID peaks in the summer and winter, sort of. It's also kind of a year-round virus at this point. And those recommendations for RSV and influenza, they aren't actually different from what the CDC currently recommends. On COVID, the West Coast states still include recommendations for, essentially all these high-risk groups. So people over 65 should get the shot. People with underlying conditions should get the shot. They have more expansive recommendations for children who they say should get the shot. Essentially, very young children, 6 months to 2 years of age. That's a group that they say the evidence shows is at higher risk and should be vaccinated. And then they have this kind of catch-all, which is that anyone who wants to choose protection from the virus, anyone who essentially asks for it or chooses it should be vaccinated as well.
So I feel like we can't talk about this issue and these debates without discussing how we got here, which means that obviously we need to talk about everyone's favorite time period to discuss, which is the pandemic. You and I both covered the vaccine rollout extensively and the political debates during the pandemic, what happened in the hospitals throughout the state. And what do you think that we need to understand about that time period that informs why we're here now and what we're hearing around these debates today?
Yeah, it's a great question. It's one I will probably be grappling with for the rest of my life. I have a few thoughts about that. And one is that I think the pandemic drove a wedge between a lot of members of the public, and particularly people who were conservative or Republicans, and the public health establishment. And, I think one of the things that's been really striking to me about the pandemic, I became a health reporter during the pandemic. And so I was experiencing it myself as a person, with a child going through lockdown. But I was also experiencing it a little bit, had a little window into the eyes of people who were working in healthcare. And it was really different. If you were going to a job where you were actually seeing people dying daily, that was a very different way to experience COVID-19 than for people who were just experiencing it in their own personal lives. And so, I think the health establishment really focused on the harms that they saw firsthand in a way that others maybe didn't see firsthand: death, hospitalization. And then I think, the public felt like their daily lives were completely upended, and in some cases in ways that were really harmful. School closures is what comes most immediately to mind. And so, and we maybe had this moment initially where vaccines seemed like they were going to be a bipartisan issue. We had vaccines that were developed under President Trump's Operation Warp Speed initiative. But kind of by the end, vaccines got pulled into the politicization of everything as well. And so, you ended up with people who I think were really angry at public health for the degree of power it exerted over their lives in this really difficult time. And I think for maybe not acknowledging the harm caused by some of what they asked people to do. And then you have people who are, people in public health who I think feel like the degree of harm that they experienced was never really, recognized or reckoned with. And the death and the scale of the destruction caused by the virus has been minimized or dismissed. So yeah, just this fracturing of trust that took place. And then, throw into the mix misinformation. And yeah, now, we still haven't really figured out how to cross that divide.
Amelia, a lot of people who pushed some of the most controversial medical opinions around the pandemic and vaccines, they've now risen to positions of pretty high power and authority, right? Can you just talk about some of them?
Yeah, I think it makes sense to start with Robert F. Kennedy Jr., the current Secretary for Health and Human Services. He is, maybe the country's most prominent vaccine critic, skeptic. He founded a group called Children's Health Defense, which has spread the unsupported claim that vaccines are linked to autism. That group was also very active in sharing misinformation during the pandemic related to vaccines. And it has sued to try to remove many vaccines from the market, including trying to challenge the COVID-19 shots authorization for kids. Kennedy has now appointed a number of people to this committee, ACIP, that comes up with recommendations, evaluates safety and efficacy of shots, who were sort of, I think you could say, like pandemic public health contrarians or people who challenge the public health response to the pandemic. Those include Martin Kulldorff. He's a Harvard biostatistician and was one of the authors of the Great Barrington Declaration, if you remember. That advocated lifting restrictions like masking before vaccines were available. There's also Robert Malone, a vaccine expert who has been very critical of mRNA shots, like the COVID vaccines, and active during the most recent measles outbreak in Texas, supporting some of RFK's views. According to the Texas Tribune, Malone was part of a group of sort of allies of RFK who were encouraging families of children who died of measles to accept alternative explanations for those children's deaths. There's also Retsef Levy, a professor of operations management at MIT, who on social media has called mRNA vaccines dangerous and said they should be removed from the market.
And how has RFK Jr. and HHS responded to some of these accusations and the creation of the West Coast Health Alliance?
They have panned it. A spokesperson for HHS said Kennedy fired the original ACIP members, the original ACIP members, because the group was rubber stamping vaccines, and said that Kennedy is restoring public trust in the institution. The spokesman told us that HHS's policy decisions will be made using what he calls gold standard science, and that the West Coast states are the ones who undermined trust in public health during the pandemic by pushing unscientific practices, pushing mask mandates, school closures.
So let's go back to talking about some of the recommendations that are being made. Like, why, from the federal level, why do recommendations by the federal government around vaccines, why do they matter?
I mean, all sorts of reasons. They have guided pediatricians, pharmacists, to know and understand who should and shouldn't be vaccinated. Not every vaccine is recommended across the full spectrum of ages. These govern how frequently people get doses, what the appropriate doses are. They give people confidence that vaccines are safe and effective, not just broadly, but for their specific, group. And they determine all sorts of things like insurance coverage through Medicaid, through the Vaccines for Children program.
Mm-hmm. And what do we know, like what evidence is there about the safety and effectiveness of some of these vaccines? Can you just talk about that a little bit?
Well, for the COVID-19 shot in particular, the vaccines went through clinical trials when they were first developed, and the vaccine makers have continued to present updated evidence around their safety and efficacy as the boosters have been reviewed. There are also surveillance systems, one known as VAERS, that essentially track any event that happens soon after a person was vaccinated, even if it's unlikely to be related to vaccination, to try to make sure we're looking for infrequent but serious complications and side effects. You may recall the Johnson & Johnson vaccine was actually pulled from the market after this system, VAERS, confirmed that there was an association between that shot and a rare but very serious risk of blood clots. So we do have a lot of surveillance. We have a lot of safety and efficacy data from just the real world experience of, millions of people getting these vaccines. The question of efficacy is a really interesting one to me, because, of course, this is a virus that's constantly evolving. It's doing that to escape our antigens that try to, kill it, target it.
Right.
And that makes it hard to design an effective vaccine, kind of just like with the flu shot. So what we know about that, Pfizer in their presentation to the CDC had said the shot is between about 40 and 70% effective at keeping people out of the hospital. That was the most recent booster, not this current one, but the previous years, because there's kind of a lag in the data. Other published research that I have seen suggests that, there is this sort of continuous challenge with trying to match the boosters to the variants that are currently circulating. And there are challenges around waning immunity. So the shots tend to be the most effective at, say, preventing infection and transmission within the first 30 to 90 days after you get them. And what public health experts say is what you still get is a lasting immunity, essentially an immune memory cell response that gives you much more solid and durable protection against those serious outcomes, hospitalization and death.
So let's get back to talking about the Health Alliance specifically. What does this mean that Oregon has joined this alliance?
It means that pharmacists and doctors in Oregon will follow recommendations set by this group of state health officers as opposed to the CDC. It means that in Oregon, vaccines recommended by the West Coast Health Alliance will be covered under the state's Medicaid program and will be covered by private insurance companies that the state regulates. Some private insurers have come out and said they intend to continue to cover a number of vaccines regardless of what ACIP decides this week. And I think more broadly, it just means that, the state is trying to signal that it still has confidence that vaccines are safe and effective.
Mm-hmm. So it's fair to say a major change, right?
Yeah, absolutely. And the state does have a fair amount of authority over this area of policy. It's complex. There are certain things that are still, vaccines are still approved by the FDA. There are any number of things that do not happen. There are any number of things that do not happen at the state level here, but the state does have a certain degree of power and authority here.
And so this just feels like an entirely new role for the state government when it comes to vaccines and healthcare, right? Like in the long run, how could you see this changing things?
That's a great question. It is a new role. I think it's a tremendous responsibility to essentially say to the public, we are conducting our own independent evaluation of all of the available safety and efficacy data and, coming up with these scientific recommendations. That is really new. I think the state is going to have to figure out how to do that in a more consistent and public way, frankly, than this initial set of recommendations was hammered out over a couple of weeks. And, while we've been told they're based on guidance from the major medical organizations, we didn't really get to see the deliberation process happen. I think that's a major drawback. And then, in the longer run, I think there's all sorts of questions about if the state is promising to provide these vaccines to people on Medicaid, but they're not getting the same degree of federal support for that, especially, say, for vaccines for children, which have the federal government has been very involved in paying for, previously. How is the state going to sort of take on any new financial responsibility that comes with this.
So clearly things are changing at a very rapid clip when it comes to vaccines. The committee that you had mentioned, the ACIP, they're meeting today. What do you expect to hear?
Well, they're deliberating over a combined shot for measles, mumps, and rubella and varicella, the chickenpox virus. And the expectation is that they will stop recommending that vaccine for very young children. Now, there is a non-combined version of those shots that will continue to be available. So I don't want to be alarmist about that, but it does mean that, families that have preferred doing that as a single shot would not have that option. And then they will be deliberating about the hepatitis B vaccine. Hepatitis B is an infection that can be chronic, that can cause serious harm to the liver and even cancer. And hepatitis B cases in the United States, chronic hepatitis B, have plummeted since this campaign to vaccinate babies at birth started, some 20 years ago. So that, I think, very controversial, has prompted condemnation from the Republican chair of the Senate Health Committee, who is himself a doctor. That could be taken up today. And Oregon's health officer has said that if there is any change in recommendations on that particular vaccine, the Western States Health Alliance would take that up, would do their own review of the evidence, and would likely reach a different conclusion.
Well, Amelia, thank you so much for your reporting on this. We really appreciate it.
You're very welcome.
Okay. This week's episode was produced by Andrew Thien, and our audio engineer is Stephen Cray. Our music comes from Audio Network. In these uncertain times, we are certain that you have questions about local politics. Maybe we can answer them. We would love to hear from you. Email us at opbpoliticsnow@opb.org. We'll be back next week with more political news from across the Pacific Northwest. Until then, you can find all of OPB's reporting at opb.org. Thanks for your support, and thanks for listening.